Hand them out freely. Lots of back.
So are there any other announcements from the floor? Okay, I'm going to have Melissa come up then before I turn it over to Ryan for fellowship. And Andrew, yes.
Do you like it? I'm still up, right?
Yeah. This is about you.
It's all about you. All right, wait here. Are you ready there? You can step aside a little bit. All right. As membership chair, I get to read this stuff. The Rotary Club of Clinton, through its members enhance the lives of people in our community and around the world. This is accomplished through the commitment and engagement of our members. Bringing in new members not only increases our ability to do good, but also brings new ideas and energy to those efforts. Candidate and sponsor are both here. I'm handing the membership, says membership chair hands over the new member kit to the and certificate to the membership on top. You got all the kit and everything? You got a pin? Great.
The membership chair is responsible for putting together a membership kit.
Did you provide me the membership kit?
We don't have one.
Okay. So where are we skipping to? Sponsor member.
Yes.
That's you. I'm going to step over here.
So I'll be reading both parts since I am both her sponsor and then I have to read the president section. This is new for us if you can't tell. Welcome to the Rotary Club of Clinton. I stand before you to lead you into a new and great adventure in friendship, in service, in vocation to your community, and to your fellow man. You are joining 75 members of this Rotary Club and over 1.2 million members in 200 countries around the world. All are business and professional people banded together by the common commitment to service above self. Through service, Rotarians are committed to fostering world peace and understanding, to applying the ideal of service in their personal, business, and community lives, and to promoting high ethical standards in business and professions. Helen Keller is credited with this quote: "Life is either a daring adventure or nothing. I speak to urge you forward in a new and great adventure, to become more than a member, to become a Rotarian. Rotarians are the people who look beyond differences to make a difference. There are many things you must learn. Primary is the object of Rotary, the preamble of which is to encourage and foster the ideal of service as a basis of worthy enterprise. Incidental to this is the Rotary motto, service above self, just referred to. We encourage you to learn all you can about Rotary, its organization, its goals, and its achievements, which are many. The Rotary International website is packed with information. Most important is participation, and this begins with engagement. Please find your passion, get involved, and make a difference. You will often hear the words Rotary Fellowship. You will experience this as you get acquainted with other members of this club, serve on teams, and participate in the social functions. In this way, you will make new friends and become a vital part of Rotary. Welcome to the Rotary Club of Clinton. Rotarians, help me in welcoming our newest member, Melissa Eversmeyer.
I have to go back to
I was looking up in her, she wasn't wearing a suit jacket. I don't have So we are also going to have Melissa do her new member presentation, as she has requested that she do it on a week when her boss is not present. So she's going to do that today, and then we're also going to invite Sam Jensen up, who we have already inducted, and they can both earn their official Rotary badges today.
Hi, I'm Melissa Eversmeyer. I grew up on a farm out by Charlotte, Iowa, graduated from Northeast High School. Then I went to St. Ambrose and got a bachelor's and master's in accounting. Then I started at Deloitte for 3 years in tax, and I switched over to private with McCarthy Bush Corporation. And I've worked for Clinton Engineering McCarthy Bush for the last 10 years. And I have 2 kids. A 4-year-old boy and a 6-year-old girl, and my husband Travis is the coach and teacher out at Northeast.
She has 2 3/4 children. Sam, if you would like to come up.
Hello, I'm Sam Jensen. I work at Clinton County Extension. I've been there, I don't know, 2.5 years. I started September 2019. I got off to a great start and then COVID hit and it was paused just like it was for everybody else. We've kind of noticed in doing our programming that we have a lot of programs and we do a lot for the farm families in Clinton County, but we don't engage people in Clinton and Comanche nearly as much as what we should. So if you have any programs that you think Extension can be part of, please let me know. One program that we're looking to do, hopefully in the fall, is something called Strengthening Families. We're running one in DeWitt right now, but all the families are from Clinton, so that's kind of interesting. It's a great program for parents who have, or grandparents who have youth ages 10 to 14. And it helps kind of build a good, strong family bond before they get into high school, before they kind of start spreading their wings and saying, I'm too cool for mom or dad or grandma or grandpa or whomever. I went through it. I'm a trainer. I went through it with my own kids. It was great. The Strengthening Families program is kind of a misnomer because it makes you sound like, oh, my family's in trouble and I need to do something to bring them out of trouble. I don't think my family was in trouble at all, but it made us a lot closer. So if any of you have kids, age 10 to 14, I invite you to take part in our program this fall. I don't know any other details besides that.
Anything personally?
Personally, I live in LeClaire, but I spend most of my time in Clinton County. My daughter is 15 and let's see, she drove to school for the first time last week. It was terrifying. My son is 12 and still quite a ways from driving, which is a good thing for everybody else in Scott County. My wife works for Bayer Chemicals down in Muscatine. We moved here 5.5 years ago. She worked for Arconic. And we lived in southern Indiana and they said, hey, how about moving to Davenport? And she said, well, I guess. And so here we are.
Thank you, Sam. Thank you, Sam. Now I will turn it over to Ryan for fellowship.
Guests, we have 4 student guests today. Doug, you have a couple guests?
Kaylee. Kaylee. Both from Trinity. It's their first time here. They'll be back 2 more times.
Welcome. And Miss Vickers, you have 2 guests.
They will be our guests for February.
Welcome. It doesn't appear we have any Rotary birthdays this week. We do have 2 anniversaries though, Dan Housingay and Brian Kelly. Are they here?
Brian's online.
Brian's online. Congratulations, Brian.
Thank you.
It is my son Jack's birthday on Wednesday, so I'll donate $10 in his honor. So today's trivia is about the Beatles. In 1964, today they arrived at LaGuardia Airport and would be on the Ed Sullivan Show 2 days later on February 9th. So Mr. DeLacy, your table, since you're the math guy, how many people tuned into that program that evening on the Ed Sullivan Show within the nearest 5 million?
$20 million.
I was surprised by the 73 million people tuned in that night.
Oh my God.
That's crazy. I wasn't there around. Karen, your table. Who's the oldest of the Fab Four? Who's the oldest Beatle? Correct. Ringo Starr was. Is. Good job. Andrew, your table. Who shot John Lennon on December 8th, 1980? Don't be confused with who shot JR.
No, we were confused with who shot
Okay.
Ronald Reagan.
Hinckley shot Reagan.
Yeah, Hinckley shot Reagan. I don't know, the guy who read Catcher in the Rye too much.
Mark David Chapman. Doug, your table. Which of the Beatles song holds the record for the most versions covered by different artists?
I want to hold your hand.
Yesterday. Brig, our table. Which album was the first with the complete lyrics printed on the album cover?
Sergeant Pepper.
Correct.
Whoa.
Tom Detterman, your table.
Wait, what was the answer to that question?
Sergeant Pepper's Lonely Hearts Club Band. Tom, your table. What was the first song the band performed live for an audience in America? All My Loving. Thanks for playing, everybody.
Thank you, Ryan. I don't think anybody that had that original album with those lyrics on there can probably read it without reading glasses anymore, would be my guess. Sorry. So since you guys are booing me out of here anyway, how about I turn it over to Julie to introduce our speakers?
Good afternoon. Before I introduce our speakers today, I also want to introduce Kathy Thielen, hope I said that right, as another guest of ours. Many of you may have seen the program today as you drove up, the Mercy One Mobile Medical Unit. And with us today is Andrea Barnett. She's our Community Health and Wellness Coordinator at Mercy One. She's been there for 23 years, started when she was 5. Next to her is Michelle Arensdorf, and she is an RN and a community health educator at Mercy One in Dubuque. And she has also been here or with Mercy One for 34 years. So she also started when she was 5. So with that, I will turn it over to these ladies for the presentation.
Yeah, I have a PowerPoint. Do I want to, do you want me to click on that?
Whichever one it is.
This one? I don't know. I don't know why there's 2. This, yeah, that's right. Shares the screen. Oh, yeah, I got that. Here we go. That's okay. Oh my gosh, thank you so much for having us today. It's so great to see some familiar faces that I haven't seen for a really long time. So we're here to talk about our Mercy One Eastern Iowa Mobile Medical Unit. So this is actually going to be shared with Dubuque, but I'm so glad we have it here today. So we thank these guys for bringing it down for us. So just to get started, do I just do the arrow? Okay, perfect. So I kind of want to just do like a one-on-one. What is a mobile medical unit? Oh, perfect. Okay, thank you. All right, so a mobile medical clinic, it's an innovative model of healthcare delivery that could help alleviate health disparities in vulnerable populations and individuals with chronic diseases. So particularly, and you can see on the screen here, urgent care, providing preventative health screens, and initiating chronic disease management. So those are just some of the areas that we would be focusing on. So how can a MMC support a community's health needs? So as the list here says, increase access to care. So if we can get this unit out to people where they don't come to us, but we go to them, that would be ideal. Close the gaps with insurance coverage. So this is an area that we're going to try to work on and getting certified so we can actually get people that aren't on health insurance, get them on insurance. So it helps with their care as well. And then link people to needed health and human services. So connecting them with mental health issues, any of the social care organizations that we have in our community, making sure that they have access to those things. And then promote collaborative and coordinated care, increase patient navigation, improve the delivery of services. And then of course, the ultimate goal is to improve health outcomes. I guess I could use this thing. I just keep reaching over there. So populations that may benefit from this kind of unit would be people obviously that lack transportation. So we're a very rural community. So we have a lot of outlying areas that we would like to maybe get to. And I'll talk a little bit about our service area as well, but isolated populations. So populations that don't really feel comfortable coming to a clinic or coming to a hospital, maybe we can go to them and get them the care that they need. Schools. So this would be, and I know Michelle will talk a little bit about this, but going to schools and giving vaccinations. A lot of these students aren't, maybe the parents don't have time to get them to their primary care to get them their vaccinations. So we could go to them and get the vaccinations for them, or just do dental care or some of these other things that a mobile medical clinic can do. Homeless. So they just did a, is it a PIC account? You probably know, Jen, where they go around and they count the homeless in our community. How many people do you think we have homeless in our community? Anybody want to guess? Oh, she knows. Yeah, I forgot you were over there. Who said 100? It's actually lower, which I was, yeah, it is good. That is good. But was it 71? 74, 74. Okay, 74. So again, those are things that we could go out to these people and get them the healthcare that they need because they're probably not getting the healthcare they need. Veterans. So this is actually kind of the program was supposed to be on our MILVET program today, but we're kind of putting that on hold. It's still going to happen, but connecting with veterans, because veterans are a population that have high mental health needs. They have high substance abuse problems. So not every veteran, we're not categorizing, but there is that it can happen. So if we can get to them and give them the healthcare that they need to, and not all veterans do get VA healthcare. I don't know, I think it's only 15% of veterans actually get veterans healthcare. So that was something that was new to me. So again, that's a great population that we can help them and get them the care that they need. And then people who cannot easily leave their place of employment during business hours. So that is probably like down the road, kind of a different phase. So more like corporate wellness kinds of things. So again, but it's still an opportunity with our unit. So this was something, and I'm hoping that we can get our unit on this website, but you can find clinics mobile. You can actually click on this link if I send out the PowerPoint. So you can see across the United States where the mobile medical units are located. Who wants to guess where the highest number of mobile medical clinics are? What state? That's one of the top 4.
New Mexico.
No.
Alaska.
Think about where high homeless populations. California is number 1. And then it is Texas was number 2, 73 clinics there. And these are only people that are reporting the clinic. So, and ours isn't even on there yet, which I think we're going to get it on there. But New York was 3rd, and then Florida was actually, it really dropped though. So it went, California had 140, Texas had 73, New York had 71, and Florida had 58. I just did the top 4, but you can go to this link and kind of search to see where some of these units are located. And then I listed, these are the clinics that are listed in Iowa. Right now, there's only 4 that are on the map. And the thing about this, I think this would be great data because this website actually collects information. So what they're doing is they're reporting like how many people they're touching. So you can see, like, I think, they've had 6.5 million visits annually in the United States. So that's how many people these clinics across the United States are actually having encounters with. So if we can get our information on there as well, this would be a great database to have. Some of these clinics offer a range of services. So I'm just going to kind of list what the top ones were from this data collection. Was 42% surveyed offering primary care. So they were doing a lot of the primary care services. 45% were offering preventative screenings. 30% are doing dental screenings. And then they also are doing some specialty care such as mammography, mental health, and some vision things as well. Any questions about that? It's a really great, I think it's a great thing that they're collecting this information as well. So I just wanted to also kind of give you a background. We talk a lot about social determinants of health, but I don't know how much people really understand about it. So I think it's just a good thing to kind of review. But when we look at social determinants of health, there's 5 different areas kind of that we really focus on. So economic stability, education, access and quality, healthcare access and quality, neighborhood built environment, and social and community. So those are the kind of the 5 domains. And then what I did was I kind of put these together. So you have on the left side, the determinants of health, those are the domains. And then I gave you kind of examples of what determinants of health would be. So like safe housing, transportation, neighborhoods, racism, discrimination, violence, education, job opportunities and income, access to nutritious foods, physical activity opportunities, polluted air and water, language and literacy skills. So then on that 3rd column, I really kind of just looked at our service area to kind of identify based off of our community health needs of what are our social determinants of health. So for our service area. So we have a high poverty rate, and I'll kind of go through the numbers in a minute, but high percentage of free reduced lunch. We have low education, high number of veterans, high percentage of Medicaid. So you can actually find this whole full community health needs assessment on our website. I included the link here, but if you just go to the Mercy One website, you can click on, I think it's About Clinton is like right on the top, and then it will open up on the side and it will have our community health needs along with our strategies that we're going to work on for the next 3 years. But just to kind of highlight a few of those things, and this is from 2014 to 2018 because data always seems to be a little bit behind. So, but 30.4% of individuals in the service area are living in households with income below the 200% poverty level, federal poverty level. I think that's a pretty high percentage for our service area. And of the 21,417 enrolled students, 48.7%, which is about 10,435 students, were eligible for free or reduced lunch. Again, the average for Iowa was 42.5. So we're about 6.5 or 6.2% above that. Medicaid in the service area is approximately 21.5%, which is higher than the state, which is at 19.3. Illinois is at 21.2. So it's not much different, but and then 21% in our area are receiving Medicaid, and 4% are uninsured. The education report, so 42.5% report scoring non-proficient or worse than that. The state of Iowa is at 26.8. So we have a low, we have a lot of room to grow in that education area. And then veterans were at 9.4% in our service area, and Iowa's at 7.7. So again, a little higher population for that. So any questions about that? Okay, so moving on to our kind of mobile medical clinic here. Unit, I always call it, I don't know if it's clinic, some places call it clinic, some call it unit, but we're going to call it clinic for right now. So what happened is we kind of identified some of these needs in our area and Dubuque as well. And Dubuque is really trying to kind of ramp up their community benefit in their community as well. So this mobile medical unit will really help with that. And, you know, hopefully we're sharing that as well. What we did was Trinity Health, every year you can apply for different grants. And this grant particular is a Trinity Health Preserving Our Legacy grant. And it actually probably was initiated right before COVID. And then we had to put it on hold for like 2 years almost. And then we kind of got the money and we were able to get things kind of moving. But this is the grant specifically is to help kind of build that like the Winnebago. So we were able to get a gently used Winnebago, redo the inside, and make it a mobile medical clinic inside of it. So and just to kind of let you know, our service area in Clinton includes those 4 counties. So when we look at some of our population, these are people that come into the hospital, come into our clinics. That's how we identify what our service area is. So we got Clinton, Jackson, Whiteside, and Carroll. And then Dubuque, she'll explain a little bit about Dubuque in a minute. And then this just falls in line 100% with our community health needs, which again, we have to do every 3 years. We have to survey our community to really see what are our health needs. And you can see by some of the data that I just showed you, what are some of the top health needs? I know you know.
Yeah.
He was on our committee.
Mental health, access to care, and
Substance misuse.
what?
Substance abuse, yeah. So those are our top needs. And all of those things kind of tie into poverty levels, education, economic stability, all of those things that we talked about, what the service area that we're serving. So these are our priorities for the next 3 years. So we look at fiscal year 22 through 24. And again, on the website, it will give you the whole 30 or 40 page document that you probably don't really want to read, but it does have a great data in it. And then there's the strategies, there's a strategy plan for each one of these needs. So other additional focuses from what we kind of surveyed were obesity, poverty, access to food, suicide awareness, and cancer prevention. So those are kind of other areas that will be infiltrated with some of our strategies as well. So then just to kind of put this out there to kind of let you see how this mobile medical unit can really tie into the objectives and back to our strategies with our community health needs. So when we look at the 3, brain health is the first one. We call it brain health. And just because mental health has this negative connotation to it. So when you think of mental health, you think somebody's mentally unstable or mentally, but when you think of brain health, it just really is the goal is to get your brain healthy, just like you want to get your heart healthy, or you want to get your lungs healthy, or you want to get your body healthy. So if we look at it that way, I think it just kind of has more of a positive connotation with it. So brain health is one of the priorities for our mobile medical unit. We will be doing health assessments. We're hoping, and she'll talk maybe a little bit about the team that will be on the unit. But if we do get this team, it would be really directly related to brain health. And then screening for those social determinants of health. So even though we have all this great data and we can go to CDC, we can go to the Robert Wood Foundation and look up all this data, we don't really, that's just, hearsay. We want to get out to the people. What are your social determinants of health? Is it transportation? Is it financial needs? Is it education? What are your needs? So we want to get out there and really assess that population. So when we go out and do things, we know that we're getting to the root of the problem. And then substance abuse or substance use, and I think we actually call it substance misuse now again, but assessing for those types of things and getting those people that do have issues connected to the resources that they need, because maybe they don't know where to get those resources. And then there's another program that we have in our plan, and it's called Healthcare Committed Assessment. And this is something that I hope that we can implement within our clinics, but also on the unit. It's just 5 simple questions. And this is an evidence-based program. It is called, or the 5 questions would be, do you have any friends who drink? And this would be more, I think there's youth or adult, but these are the 5 questions. Have you ever had more than a few sips of alcohol? In general, how do you think things have been going for you lately? What are the things that are most stressful for you? And what changes have you noticed in your sleep? So that's kind of this healthcare committed program, that those 5 simple questions could help identify more needs and what direction we would need to go. And then you can see the access to healthcare. And again, these are things that we would really want to, get educated on, but getting certified so we can file for presumptive Medicaid for uninsured, bring healthcare to vulnerable populations, vaccinations, connect individuals with providers, and then screen and educate for heart disease, diabetes, obesity, and then have a produce cart with healthy food items, bring that to them. And then we also have blessing bags, which is it's just kind of things that we can give to that population of things they may need. So this is kind of our timeline locally. I just put together kind of an introduction phase. So because we're kind of, this is really kind of all new for our area. So we really want just to bring the unit out to the community so people can see it. We can start creating relationships. We can let you know that we're here to help. We're not, this isn't a promotional thing. We really just want to get to the root of the problem and really help improve the health of our community. So any service organization that you would like us to come to, we can do that anywhere in the community. We actually are going to be Wednesday. We're going to Quality Inn. We're going to offer vaccinations if anybody would like those. And then again, if there's other locations that you have an interest for us to bring it to, just let us know. I'll leave my business cards on the table over there. And then the next phase, really, we also may use it as going to events, and you can go to kind of like a first aid tent, but you can go to the clinic if you're in a race and you sprain your ankle, or you need like just basic first aid care. We'll have it at some of those events. So if you know any events in the community that you think would be a good place for it to be, please let us know. I just listed a few of them that I know about. And then eventually, hopefully in May, we're going to get a designated team. So this team will be the team that can go around and actually do these services and do the health screenings, do the preventative care, do the brain health screenings, and all of these vaccinations and things. And they are doing some vaccinations currently, but I think the whole idea is to make sure that we have healthcare on wheels and people know that they can come and get the care that they need. So here's just a few pictures of the vehicle. If you aren't able to stay, we are going to be doing tours. So if you're able to stay, we'll have it open. You can come look at it. If you can't, we've got some great photos here. It's handicap accessible. So you can see how that kind of opens up there, and an awning. And then there's Michelle. She can be the little check-in person here, checking people in. So that would be the front door that you would come in. And then we have 2 exam rooms. Very nice size, handicap accessible, and exam room 2, and then the bathroom as well. And that's handicap accessible. And then I'm going to let Michelle take over of the things that they're doing.
So definitely a phased in approach. Thanks for having us here today anyway. So right now we're just in the phase 1 where we are, getting it out there. We have teamed up with schools in Dubuque for vaccinations. Our main goal through the whole thing is not to duplicate any services. I know Dubuque has a lot of great things going on. So does Clinton. People already have the connections and are doing great things. Our goal with the mobile unit is to team up with them and find out what their barriers are. Is it the homeless that's at Quality Inn that just can't, get the vaccinations that they need? So our goal is to not duplicate any services that are already going out there, but more partner with all the community partners to find out, where are your biggest struggles? Is there an area, that you can't reach? I know Dubuque with our Crescent Community Health facility we have there's a big group up in Postville that they just never, there's a big group up there that need a lot of health care and they can't reach. So that's one of our goals, is to take the unit up to them and help them out. So again, their biggest thing is not to duplicate anything that somebody's doing, but to help accent what they need more. So we have done kind of phase 1 is we got delayed obviously because of COVID and that, but we were definitely out doing a bunch of vaccinations, boosters, flu shots. We're now starting to move into our April phase 2, where we have a medical director that oversees the whole unit for us. He's a psychiatrist actually and specializes in brain health. So that'll be awesome in the sense that we're going to have a nurse practitioner that we actually hire as our team that will go out with us and see patients. Our biggest thing is we don't want it to become the brain health bus. We're going to do a bunch, we don't want that stigma of you see my car next to this bus. That means I must have, like a brain health issue. So it's going to, either we're treating kids that might have strep throat. So it can be really anything. And we'll address those needs that way. What else? Community health workers, it takes feet on the ground to also help. So, to get out into your different communities, that the Marshallese group or, a group of Hispanics, you got to team up with them and find their community workers so you can build that trust together. So that's a big goal that way. And then down the road, we hope to, with the brain health and even just general medicine, do a lot of telehealth. The unit is equipped with TV and Wi-Fi, so we could connect to a hotspot. And if our NP for some reason isn't with us, or we need a medical doctor for help or assistance, then we can just group in with the telehealth and right from the mobile unit see that. So, and like Andrea said too, a lot of screenings for diabetes, hypertension, a lot of education, and then also team up with the food banks, take food out. A lot of people access to food, is a big issue that way too. So if we're going to be out somewhere, anywhere in a rural area, if we can, make it known that we're going to be there every third Thursday and have people know that they can count on that, and then team up with the food banks and that as well to get food to them. So any questions about the phases? Our area with our service, and they're hoping to have 6 mobile units across the state of Iowa, with 1 for each Mercy one. So our area and our service area will cover the Clinton area down here, and then Dubuque, Elkader, Guttenberg, and then like the Dyersville area, Clayton County. A lot of grants that we're currently working on too for funding with brain health that are out there. So we will try to meet all those needs as well. But a big service area, but we'll see how it grows. Hopefully, not hopefully, but it's like, if there's more of a need down here, then we've talked on the side, like, do we just need a separate unit for a certain area? We want to go where the need is. If Guttenberg's doing fine and really doesn't need us, or they have other resources, then we'll focus more in this area. So it's kind of like wherever we need to be, will be. So on to the next one there. This is just a little bit of data that I had from the Dubuque, that we teamed up with the Dubuque Community Schools and the West Dubuque Schools, and then also the Holy Family Catholic Schools, and went out and did the vaccinations. We held them after school. The schools' vaccines are very political, and they didn't want to make that distinction pushing the vaccines and stuff. So what we did was we held the clinics after schools. And then the parents came with the kids, and we did a lot of actually parents boosters and some family first time shots as well when they came through. But a total of 1,208 total patient encounters that we had between kids and adults through that time. And that was just over a couple months. So it was a busy couple months, given a lot of shots. Kathy can attest to that. She was one of my nurses on the unit helping in that. So, but a great time to do education too. When you have a family in there, how are you doing? A lot of us, even just, mentally, when you go through a pandemic like this, you feel like you have stuff together, but a lot of us kind of, feel like struggling a little bit with keeping things together, and the people that had issues, before the pandemic definitely will be struggling now. So that's why our main focus definitely will be on brain health, because that really comes from everything. A lot of our health issues that we have down the road stemmed maybe as a child from anxiety, or just not having the support that we needed. So this is again last week, and Andrea touched the fact we were at the Veterans Freedom Center and just kind of seeing what they need. They're going to be doing that honor flight coming up in May. So we did a lot of the vaccinations 2 weeks ago, and now we'll go back out and test them too, to make sure they have a negative test before they fly. So it's really it's nice about the mobile unit, because we can make it what we want it to be. It's kind of a new thing for our area. So if there's a need and we can work with a community partner, we can really make it what we want it to be. The focus again will be on brain health, and a lot of screenings, connecting people to the resources. With the mobile unit itself, a lot of the care will be charity care. We talked about connecting people with insurance and stuff, so we can treat them on our bus. That'll all be charity care. But if we know that down the road they're going to need maybe an abscess, surgery or something to clean up an abscess, or they're going to need to go into the hospital, then we'll help them get on that presumptive Medicaid and help them find the resources that they need that way. Questions? Yeah.
When you provide healthcare, say at school and provide a vaccination, you pay your doctor and let them know that vaccination is given if they have?
With all vaccinations, we enter everything in IRIS, which is an Iowa database. So once we give the shot, within 24 hours, it has to be entered into that database. So then all physicians use that record as well. So then they can go in and look.
Oh, Rod has a question.
Yeah.
I was going to say one thing.
I know in our Dubuque area, Crescent is working on a mobile unit for dental care, so we hope to team up with them. You know, if people are coming in to have their teeth checked, let's check them for, you know, how you doing otherwise, or are you getting food?
And Clinton, we've been looking at iSmiles. They have a program, so I've actually talked with her. So again, it would be a partnership. And I just wanted to mention, because I think Michelle said it, but I just wanted to reiterate this. We don't want to duplicate what we already have in our community. We want to enhance and support what we need, what our needs are. So just for example, vaccinations, public health does vaccinations. So we don't need to duplicate vaccinations, but if they need assistance, which we're going to help them on Wednesday because they haven't been able to get out to the hotel, the Quality Inn where homeless people are living right now. So again, it's that partnership. So just so we understand that we really, that's kind of the goal, is not to duplicate, but to enhance what we can. Any other questions? Yeah.
Is your funding 100% grant funding, or you got private funding also?
So yeah, that definitely the actual unit was 100% funded, the current built of the unit, but operational cost will have to come from RC. And that's our community benefit, giving back to the community.
What was the total cost of the unit? What was the capital?
Well, the actual grant was like 250,000. So to duplicate that to get another one, so we're not sharing, you know, again, we would be looking for another grant. And, you know, when you go, if you're able to come look at the unit, I mean, maybe we don't need 2 exam rooms for, you know, something down in this area. Maybe it needs to be a smaller version of that, maybe a minivan or an old ambulance that, you know, we could use, that we could have here 100% of the time. So again, those are things. I think right now we want to introduce it to our community, see how it goes. And then if we feel that we need one, it will definitely be something that we can look at into the future.
Are you getting out to the Kalmuses and the Wheatlands and the little?
Those are, they're in our Clinton County. Yep. That's that rural area, Sebula. I don't know, they might be Jackson County, but yes, some of those little towns. It's kind of, I mean, if you can look at a vision, and Melissa said this the other day, if you could look at a vision of the day in the bus, you know, maybe it would start in Dubuque and you have your team, and maybe they, you know, drive from Dubuque, they come up, go to DeWitt, stop at some of those little towns, come through Clinton, and then go home. I mean, that could be a route that happens until we can get to the Illinois side. Yeah. And then that will make it a little bit more difficult, but because we need to get on the Illinois side too, because Whiteside County, Carroll County, they're part of our service area and we need to service them as well. But that's down the road because we have a lot of red tape to go across the state.
We run into that too in Dubuque, just with Wisconsin and Illinois right there. But right now with licensing and that, we have to stay just in the state of Iowa.
But again, that would be a goal, you know, so that's kind of what we would hope it would look like. So, and it may not be every day, maybe it's twice a week, once a week, but.
Definitely stop out. Yeah.
Yeah. So if you guys want to stop out, come see the unit.
Thank you both for that presentation. Honestly, that was completely new. I had no idea that we even had that. So awesome. Thank you to our guests for being here. So Andrea, Michelle, and Kathy, thank you. And our student guests, Kaylin, Kaylee, Nathan, and Ethan. And thank you to Rod for greeting, Paul for invocation, Ryan for fellowship, and Julie, of course, for the program. So with that, oh yes, the book. Each week, our club donates a book to the Children's Department of the Clinton Public Library on our speaker's behalf. So this week we have Change Starts With Us, which seems very appropriate. If you would like to actually sign the back here this time. So the sticker's moved. Okay, so, and then they will go out and give tours if anybody would like to go out and see the mobile medical unit. So with that, serve to change lives.